Dr. Justine, kindly tell us how we know that this is meningitis and not anything else, because off air we've spoken about how it can mimic other things, and that a fast diagnosis is really key to saving lives when it comes to meningitis.
Right. So meningitis initially will present with severe headache. Somebody will have fever. We call it photosensitivity, where they don't want to see the lights. And if it is in small children, they'll be very irritable. And as the disease progresses, it can even cause somebody can get into coma, altered mental status. And the other classic sign is neck stiffness. Neck stiffness. So meningitis, especially bacterial, it is very acute. It needs immediate and emergency care. So somebody to present to the health facility so that they are able to diagnose. One of the best critical thing is they tap what we call the fluid from the spinal cord at the back. So there is a tap of that fluid, and they take it to the lab, and they'll be able to tell if it is meningitis and what type of meningitis. Remember, we have bacterial, we have fungal, we have all those. And the right medication is very critical. If we don't do that, then somebody is can easily die, can easily lose their vision, can easily have some impairment to their brain. If it is a child, the deficit might even have learning disabilities later on, or some, weakness of the limbs. So some disabilities that may follow if not attended quickly, or even death.
Daktari, my teacher was sick for just 24 hours.
Right.
How do we effectively, one, note that this is meningitis, and then how do we effectively respond towards it? Because 24 hours is such a small window. Yeah. And you know how we Africans are. I'm saying we Africans because when I get a headache, nasema, kunywa maji, lala kidogo. Yeah. And then how do we respond to this,
ginger,
and how fast and effective? Yeah, ginger, honey, lemon is our save the day off the counter drug.
Yeah, unfortunately, meningitis you cannot diagnose at home. You need to go to the facility. Severe headache, vomiting, fevers. Convulsions if it is in a child, or sometimes those whose fontanelle has not closed. You see it raised and tense. So they need to be taken to the facility immediately. So the tricky part is how fast you get to the hospital to get the medication. And the medication they are mostly injections, so they're usually admitted. And treatment for bacterial is even up to 14 days, 2 weeks. For fungal can even take longer, 14 weeks in the hospital, and thereafter you take the treatment even up to 1 year. That is for cryptococcal meningitis. For TB meningitis, way longer also, 6 months and beyond. So really the causative agent determines the treatment. But the critical thing is how soon do you present to the facility to start the treatment.
So it's imperative that people move fast.
Fast.
I'll ask about the work that the Drugs for Neglected Disease Initiative is doing. I know you're present here, like Southeast Asia, South America, running amok, so to say. Yeah.
Yes. So Drugs for Neglected Disease Initiative is a research and development organization. So we are developing products or drugs for some diseases, and one of them is a particular drug for what we call cryptococcal, a type of fungal meningitis. So we want to make a better drug. We have the drug which is already there, but needs to be given 4 times in a day, every 6 hours, tablets. And yet some of these people are in coma, very sick, people who have HIV and now they have meningitis. So we are developing what we call sustained release flucytosine, which you, instead of giving 4 times, you'll give twice a day. And it is easier. You can give somebody who is even in a coma easily. But beyond that, we have medication for this meningitis, for advanced HIV disease, the fungal one. Yeah. But they are not registered in our countries. Even for Kenya, for example, these medications are not available. So one of some of the work that we are doing is we are trying to help the countries or create awareness so that countries register. Yeah. They get the registration the normal way you get approvals for the drugs. And beyond that, they are also quantified so that they are availed in the hospitals. It can be very sad. Yes, the patient is there, but you have no medication. So this is one of the ways we work as DNDI. to make these medications available. We partner with very many people, the manufacturers. They can develop generic, cheaper ones, but also countries so that they have registrations and also fund and to avail these medications. Beyond that, also promoting the training of healthcare workers so that they're able to give these medications. Some of them are really complex and the administration needs some ways of the technique of to administer. So that is also some of the ways that we support as DNDI.
Thank you so much for the work you're doing and for shedding insight into meningitis, prevention, treatment, of course, and the work that's being done. I'm giving you something we call Makofi Kaolomi Day, which is just to appreciate you,
Thank you.
Dr. Justine. Thank you so much for spending the morning with us.